So this is this presentation is almost as word as was the one I tried to give to Russia one time, and about SNAP benefits and the value of stuff, and that was weird. I won't go to it one time. That was really weird because my face was just like this huge screen behind everybody, and then my sound kept going up and down constantly, randomly. That's the weirdest thing. And then it cut out altogether. This went on for like 40 minutes, and then once they gave up on this whole conference, and I was like, whatever you want. Anyway, that's a different story. A long time ago. Weird deal. Anyway, so what we've been talking about is the effect of having fiber in your diet, 2.5 extra grams a day on average, if you're doing that. And obviously this would affect and improve low-income populations more than people who are more health conscious, who might be more sensitive to what they're eating already. They're already eating high fiber in their diet or not eating a lot of bread anyway. So what we're kind of getting to is the idea of that we need some sort of, what sort of information do we want to have available to us? So we believe this thing's completely true. The changes will be beneficial for our populations we care about. And also that so that analysis might look at the health costs, lives saved, improvements in quality of life. And then we might want to think about the possibility that people may change behavior if wheat products now have increased fiber. So, I have a healthy donut, I can take a second one, is the idea. Someone said or quipped about it, and I thought, that's a possibility, right? Now that there's healthy donuts, I mean, gee, I'm going to eat two. And that's not going to really help with obesity. So it might have some counter influences of that behavior. So I have a couple questions. So discussion question one. Considering the many situations in which the Coalition for Grain Fiber and Diet were discussed, what financial and other metrics do we need or want to measure this? So what metrics would we want to see? And I'm going to be a good professor and just let you think and not tell you the answer, because I don't know the answer, but in this case.
Question from the plant breeder in the room. If you say, what financial metrics do we want? Are you thinking like monetary savings for an individual or a population, and are we talking about healthcare?
It is talking about healthcare and individual impacts, both at individual level and then aggregated across. How would you want to know that this is really, from, evaluative standpoint, from that large study or small study or whatever, that you'd want to see if this is good or not? I mean, it's the same question they asked you. How do you know if you did this, is it really going to result in the outcomes you're claiming? Does that make sense? It's the same question, really. It's just a different framing context. And I think that's something that is going to be driving the agenda of the coalition, I think, going forward, is try to address this question. What you tell us what you need. Does that make sense? That's why we're asking it, because I'd like us to figure out what that is. Because I think it'll move the agenda forward, right? So I'm going to speculate that it might take a minute for you guys to think about this. I'm not sure we're going to spend. So we might just send an email to everybody. You guys can, if you want to type in your answer, you think about it. Would you like to think about it a little bit? I mean, typically I give it to my students and be like, yeah, it's due on Tuesday next week. That would absolutely work. Yes, sir.
So if you think about this, and we know it's multifactorial, is it wise to just hang your hat on one thing that we're just going to concentrate on fiber? Or you might get more buy-in and actually make more progress if you say, we will be part of the coalition against obesity. And then part of that is the whole dietary change to what's our part, how do we fit into that? Because I think everybody recognizes obesity is a huge problem impacting so many different systems in the body. And so if you start to look at metrics like that is, okay, so how do we help on this whole thing? For instance, do whole grains pass at a slower rate so people don't feel as hungry? One of the real benefits of whole grains, you know, those types of things is the whole grains, the fiber is part of this whole thing that we have an obesity epidemic. If we don't do something, we as a country will cease to exist. I know, hyperbole. If you didn't have hyperbole, the world would end, right?
Sure, I'll go with that. No, I think that's really good. I mean, I think, you know, so what you're saying is that here's this innovation. How does it fit in this overall plan to reduce or impact obesity and other health-related consequences? Because like colorectal cancer isn't necessarily, I mean, it's not, it's partly fiber related. It's also partly obesity related, you know what I'm saying? So it have a multiple impact on that. So I do think it couching the whole conversation, or what you're saying is saying, hey, we're going to try to have this innovation in the current situation, and how we think that would change the health outcomes for people. And then you have to look at across the whole population and say someone who's skinny versus the people who are morbidly obese. You'd have to evaluate them across all those populations, right?
This group wants to affect colorectal cancer, right? Or other cancers, right?
Yes.
Okay, but I'm not sure just having that message, because we know that there's so many other factors. And this goes back to the clinical trial. I'm going to put all my proverbial eggs in the basket that this is going to show a difference, and it may not on its own. So
Sure.
it's a conjunction with some other things. Yes, now we're making progress, or now we have it.
Well, I wouldn't think this is going to solve the problem by itself. I mean, I don't think anyone could claim that claim. So I think the idea of having it as part of an overall plan to try to make some changes for the whole health system. I mean, I just remember when I was living in Australia, you know, they have, if you've eaten the celery in Australia, but it actually has flavor to it. Like the flavor here, you know, it's like, you know, well, I mean, cardboard and the celery are not, I mean, this is like kind of like, you know, not, I mean, it doesn't have a lot of flavor to it. It's not enjoyable. I remember eating the celery just because I liked it over there in Australia. I was like, oh, I can do one of these, right? I didn't have to put peanut butter on it, you know, to get it down. Anyway, but I think couching the whole thing as an overall solution is a good idea. So that's good. Anyway, would you guys be willing to, if you want to think about that question, we send you a question by email. Would that be something that you might be able to respond to? And we think about it a little bit and say, you know, what sort of information, because it's not an easy question. You know, if it's an easy question, we probably have already figured it out, right? So very good. Good thoughts. So thanks. So far here, so we are at the second one here. So how might this innovation change behavior, and what should we do to maximize the positive benefit? So we want this innovation. We're thinking it's going to change behavior. So if you have healthy wheat, is it going to change behavior? How could we maximize it? Well, people probably eat more wheat, maybe, right? So it would actually help out Nebraska wheat growers or wheat growers in general. So you look like you have a thought. No? No? So how do you think it's going to change behavior to have healthy wheat in the market? Another complicated question, because we're going back to partly your thing, right?
I think to answer that question, you have to think of individual commodities. And from the producer standpoint, I think it's very different. From the consumer standpoint, I don't think there's going to be a lot of change until there's adoption of understanding why there's a new product on the market.
And hopefully there's not negative change now, like, oh, now I don't have to eat whole grains because I get fibers or these new products and cakes and sweets.
Okay, so there could be room for like studying how people's behavior. Well, no, but I mean, that's what happens. The first time I think I was talking to Rice, the first time I mentioned to somebody, they said, oh yeah, now I can have 2 donuts instead of 1, you know? I mean, so it's like, you know, you shouldn't have any donuts, you know, saying sorry, but you know, just my opinion. But
I mean, you talk about this innovation, I think we're limited as Americans to how we learn of these innovations. And usually it's through the media or something like that, which is only half information or not the full story that we need for full understanding. And just like was said, I would tell you for Western Nebraska medical facilities, they don't have enough time to fully engage in the whole conversation that even myself need, but a lot of people need to fully understand that. So they're diagnosing my problem and prescribing something, but they're not reiterating the food that I need to feed me. And then that brings up in my mind, which is really exciting to me, is the food is medicine kind of concept. And when is insurance gonna come into play there? And so my doctor can prescribe that I buy that bag of apples and I get it half covered from my insurance policy. You know, and so it's just so multifaceted that it's really cool, and I want to see the innovation, but I don't think it'll be happening in my lifetime. But I think my children are on board for it. And that's why I say, I will tell you, in my 30-year career, we've made strides in this whole healthiness. And I always say it when I go into high schools. Go to any high school, they drink way more water than I ever did as a 16-year-old. And I won't say I grew up in a real unhealthy family. It was pretty much a rural farm family. But kids and my children, oh, they'll drink water way over any other thing now. And they're your 20s, early 30s. And so I think we have made strides, and I kind of pat myself on the back because I think that helped. But then this is a whole nother.
So we
Well,
can
it's
hear
just
both.
choices, you know, it's not easy. What can we do to help people be more successful and living the kind of lives that we want to live ourselves and we want people around us to do? You know, and people if you're in the public health space, that's what you spend a lot of time thinking about. How do you help people do that? What's going to accomplish that? And it's so, I mean, it was just really distressing because I just hadn't updated my numbers in the sense. I mean, I updated, I'm like, it's got a lot worse now, you know. Good thing we did our project, you know, see what I'm saying? I mean, what are we going to do here to make this happen? And that's what, I mean, I'm actually kind of excited about the coalition because it's like, here's a different paradigm of trying to change what people are eating. And people don't have to try. I mean, like the whole thing with Ozempic right now, you know, everyone's, you know, I know the people, I mean, one of our family friends, I mean, they used to be, now they're like skinny, you know, like, is that really going to be healthy? I don't know. Maybe that's what we need is all to take Ozempic, you know, or some version of it. Go ahead.
Since it's a coalition, we can do crazy things when we have meetings like this. I'll throw out a setting example that would be interesting to figure out how to replicate. How many of us knew that astronauts drank Tang and powdered milk? And therefore we drank Tang and powdered milk. Doing something like this and being innovative with a hook is probably the way you cross-pollinate multiple different areas of the industry of the large water bottle to your points with this generation. Great consumer product. I can't tell you how much my 20-something-year-old kids have all spent on various things that they have, but it's a lot. What's the hook? Fiber. And it's gonna have to be sexy. There's gonna have to be an appeal that gets a 5 or 6-year-old, that astronaut, and we'll do those silver pouches because we wanted to see the tag, up to the 80-year-old who's going through radiation treatment, who's been told to have a low fiber diet, but still has to have nutrients. What do you do? I think you gotta have some sizzle, some snap, and some pop. And that was another whole campaign also.
Yeah. No, I like the marketing stuff.
I do.
Yeah. I do like the marketing things because they're kind of fun. I do like the fact it would have to be on TikTok probably, for sure. Is there any comments on from the people in the audience? I don't know if there are other people online we want to address.
There is one. By increasing whole grain consumption or just using fiber amounts as a metric, what is our overall healthcare cost savings? Using, let's say, by increasing 2 grams of fiber, we reduce this much money per individual.
Yeah, that is fantastic. That's exactly, they heard the question and they were very focused. I didn't have to send the email to them, but that's really on target because really I think that is part of the question, is answering that question. So if you can save that for me, that'd be fantastic. But it's going to take a lot more effort here to finish this stuff. And I really do want us to come back to, you know, our efforts to change how, you know, I liked what Jeffrey Gould said at the beginning of the thing. The only way to predict the future is to make it. And we determine more of our outcomes than we realize in our life. And, you know, I think that when we say we don't get enough prevention, why don't we demand from our providers that they provide prevention? You know what I'm saying? That's just something I don't understand. Well, we're the consumers, we're paying for this. Why can't we demand what we want? I mean, if you have a car, I mean, if you want a sports car, you buy a sports car. You don't buy, I don't know, whatever, or something else. You get what you want, right? Why do we want to go to the doctor? We get something we don't. Anyway, that's another question. But I think our time is about up. Is one right? Or where are we at? Or do you?
If you'd like 5 more minutes, you can have 5 more.
Okay. So I'll think of, so what do you guys think of the overall conference this week or today, I guess? What do you guys think so far in terms of the next steps for the coalition, and who else do you think should be here if this coalition is not here?
I think like they mentioned over there with, I think like they mentioned over there with marketing, I'm a baker by trade. And I want to know, like, what is this going to do? Is my bread going to have the same crumb structure? Is it going to brown the same? Is it going to have a different crust? Like, is my cake going to be fluffier or denser? If these wheats with higher fiber have positive outcomes in baked goods, you can get bakers to buy it based on that. They might not care about the high fiber, but if it gives you a fluffier cake or a crisper crust on your sourdough or whatever, you'll convince people to buy it and use it just because it creates a better product. So that might help like round out your marketing. So
if there's demand for it, you know, like he was talking with Grupo Bimbo, if they just said we want it and we'll pay 2 cents a bushel more for it, I bet they get a lot of it. That's a good point. And same thing with bakers, which are another, especially people trying to make unique bread products for people. That's really good.
And the sad thing is where we're at with the breeders on this whole new innovation is a ways away. But with the locally owned, locally grown type things and all of that, we're on the cusp of that because everybody wants locally grown breads. I mean, they'll get up early in the morning on Saturday morning just to go down because she's there or whatever. So, I mean, timing is going to be really incredible. And with this innovation, I don't think we're on top of it quite yet, are we? Or maybe it's my ignorance too. We got a little more breeding and science to do before we're there, right?
Well, I think the genetics, well, she can say better than me about the status of it, but I think that you could buy the varieties and you get the fiber now if you get them.
So this is one of the goals of the science team is to do more screening of US wheat to see what we have in our breeding programs that is already high fiber. That Kansas line I talked about today is an example of something that's already in the breeding pipeline and has high total arabinoxylans. So there's probably some out there. What there is not is a large number of varieties that are planted over a large number of acres to get us up to the very large commercial scale where every product we have is in that higher fiber. Are we at the point where we could hand off a variety to a local baker who wants to do some niche products? Not quite, but we're probably fairly close to that. You know, if we can find adapted US varieties that are already out in our breeding programs. We're a lot closer to that than we are to absolutely everything being high fiber.
So there's a niche market that's closer maybe than what I realized.
I being very optimistic here and saying yes.
Cool.
I mean, you could always just buy the British stuff and plant it, right?
No, we can't because we have this little thing called drought and heat in the US. And so those varieties are not necessarily adapted to our environments. They are also not truly adapted to our baking products. So while we can say that based on UK standards and the way they bake their products, there's not a lot of change. That's not necessarily true for all of our systems, but we don't expect large impacts such that we would have to totally reformat how we mix or bake our products.
Well, I appreciate the update on that aspect, which I don't know that well by any means. But hey, so coming back to the last question, though, the final question is, who do you think would want to be here, should be here, who's not here right now? What group is not here that should be here? More people from historically black colleges. I mean, I don't know. And that's just one example I just think of. Go ahead.
Yeah, I would say probably the most important thing is that once the product's there, is teaching people how to use it, right? It will have a higher water absorption. And one of the things that, like, for example, US Wheat Associates does internationally is they take the wheat and demonstrate it in labs, how to put this into a product. So for example, a higher water absorption would work very well in like a roti or a non-leavened bread type. But domestically, there would need to be somebody to show how to put this into a product, because there will need to be a water absorption adjustment to it. And having that demonstration process involved in it would be really necessary, I think, for the adoption. And also to demonstrate what the advantages are, right? I mean, how does this actually work? What does this look like?
Well, that's the same. That comes back to what you were talking about, having demonstration product with the food and stuff. That'd be good.
Okay, yeah. I understand it's kind of expensive to host conferences like this, but I was wondering, maybe we could also invite industry partners. We could also invite children and some of their parents could come around and join the conversation. If they learn one or two things, they could also share with their peers, and the conversation we start a chain reaction that could continue.
Well, no, I actually like that idea. This actually comes back to my I was being a little jokeful or playful, I should say. I was saying, why didn't we have like a demonstration of her with her cooking some food for us as a culinary expert? You know, she could have her knives out or have the bread out. She'd be slicing it up, and then we could all try a bit, and we could do a taste test or something and see if it tastes different. Which one type of bread is this? This is my world famous bread that I've created, and saying something like that. It'd be fun to have a food demonstration with it, make it a public event a little bit. You know what I'm saying? That would be kind of cool. And if we want people to know about what's happening, make a public event where it is on TikTok or people are seeing it and thinking about it a little bit. So that's a good idea. That fits very well. Go ahead.
So if you're looking at the diseases that you're looking at and you want physician input, then I would think you'd want to have somebody from cardiology, maybe somebody from endocrinology for the diabetes, primary care for prevention. And let's see what we've got, oncology, bariatrics, be good. And cancer's here now, but those are other areas that would help maybe define what role the physicians actually could play and how they might play.
And I would add nurse navigators, because they're the ones in the practices that are typically doing the nutritional conversations, if a practice is lucky enough to have one.
Well, I'd argue that a standard part of a U.S. medical practice, like it is in a lot of other countries that have much lower medical expenses, should be focused on prevention. They'll go to people's houses, they'll talk about the needs the person has, nutritional or otherwise, and they'll provide those recommendations to them. And it's not very expensive. I mean, I was watching some person in Mexico drive around a motorcycle doing this. I'm like, I would like to have someone like come in and say, hey, you need to cook a little better, need to do this kind of things. Like, okay, I'll take your advice, thanks. But, that'd be helpful, and that's kind of what the nurse navigators are doing if they're there and have the time. So that's good. That's good. It's good thoughts. Okay. Any final thought here? Questions? No thoughts, questions? No, you can't have it. No, you don't. That's okay.
And then there is a final thought from Zoom with Miss Claudia to bring in a group of teachers or professors from the education department to help us develop educational tools that are rooted in frameworks that work in the education programs. They are so good at this. Also, people relate more to storytelling, bring in people from the social studies area and anthropologists. We need more qualitative research, studies that help us to tell our story beyond numbers. As we know, storytelling is one of the best marketing tools we have.
Well, thanks. I said I got another one back. So anyway, thank you so much. Those are great. Could you save those? Oh, perfect. Oh, that's even better. Huh? It's great to be recorded. So hey, I appreciate the audience. Great questions. Y'all were a lot of fun to get to know all of you. As you know, a small enough group, we kind of get to know everybody. It's fantastic. So thank you so much for having a great time.